It's time to imagine better health with CHI Health. 4% of you watching right now have it. One of the most common problems hand surgeons see.
Carpal tunnel. It can be very painful. Patients often restrict their activities or lose sleep.
Yeah, we'll learn about the treatments this morning from CHI Health orthopedic and hand surgeon Dr. David Clough. Good to see you,
Hello,
Doctor.
it's nice to meet you.
Good morning. Thank you for having me
I
here.
think we all know somebody that has had carpal tunnel, right? What are the symptoms, though? How does it begin? When do you start to notice something?
The main symptoms people tell me about when they come into our office is that they have tingling and pins and needles and numbness, and it's often to thumb, index, and middle fingers. It often awakens them from their night's sleep. It bothers them in the daytime when they're driving, when they're holding a book or a tablet, when they're holding a telephone. And occasionally you'll even drop things out of your hands and not know that you've dropped them.
Are some people more at risk, like regardless of profession, or other people do you see those patients come from different categories?
Yeah, the most common patients are usually 40 and over, so you guys don't have to worry about it for a while.
Mike does, actually.
Well, usually it's more common in ladies than it is in men, but young men also get this condition. It's also much more common in people who have illnesses like diabetes,
Really?
thyroid disease, inflammatory arthritis like rheumatoid arthritis, lupus. Those are very common conditions. And people who have major fractures or dislocations to their wrist can injure the nerve and have very similar symptoms.
So there are some precursors.
Oh, there absolutely are, yes.
Yeah, but you take this two-prong approach, from what I understand. What do you do that's different?
Well, we try to evaluate people and find if they have other conditions that could be treated. A lot of my patients don't know they're a diabetic or they don't know they have thyroid disease until they come in and see me with their hands tingling. And I can communicate with their primary care provider and ask them to check on laboratory studies to see if they have diabetes or thyroid disease. Sometimes we'll uncover conditions that people didn't know they had.
How often can you treat patients non-surgically, and then what forms might that treatment take?
Well, the non-surgical care are wearing a wrist brace or a splint at night to keep your wrist straight, and that reduces the tingling. We can use some anti-inflammatory medications like ibuprofen or naproxen, although we're doing less of that now than we did 10 years ago. There's a small role for cortisone injections and an even smaller role for physical therapy. Our success rate in people who have only had their symptoms for a few months is probably about 50% with non-surgical care. But we offer it to everybody and we try it on everybody until they either run out of options or they run out of patients.
That's right. That's not the first option, is to do surgery. But at what point do you make that decision where we've tried everything, we need to go in and we need to operate?
If someone has tried all the non-surgical options we have available, we offer the surgery. What I do with my patients is I line up all of these options on the first visit so they know what that continuum is. And often they'll come in and say, I've tried the splints, I've tried the medications, I'm not getting better, I'm running out of patients, tell me about that surgery again.
I think it's interesting, you've walked a mile in their shoes.
I've walked
Right?
more than a few miles in their shoes.
You've had surgery for
Yes.
carpal tunnel.
I had carpal tunnel for about 20 years, and at one point my wife just got tired of me wearing wrist splints at night in bed and finally said, wait a minute, you're a hand surgeon.
Right.
Why don't you offer the same option for yourself that you give to your patients? So I gave in and I had mine done.
And how do you feel now? What kind of difference
Oh,
did
it
it
was
make?
wonderful. I woke up in the recovery room with my tingling completely gone.
Wow.
And it didn't wake me up that night. I was keying on my keyboard, catching up with email in the hotel room.
Right
the night of
away.
the
Pretty
surgery,
quickly.
sure.
Yeah. But, are your patients awake through this? I know you mentioned you were out, right? You were asleep.
There are different options for how you do that. Most patients have a light sedation. They may think they're out, but they're only kind of in a twilight sleep. But it ranges all the way from having just an injection in your palm to having your arm to sleep to having a general anesthetic. And there are different solutions for different patients.
Some surgeons aren't based in our area. They might fly in, see a bunch of patients, and then go someplace else. But we have 15 board-certified hand surgeons in the Omaha area. Why is it important to see somebody who is here?
Well, the importance of having a surgeon who can see you any day of the week is that you've got a lot of preoperative things that you do. doing the non-surgical care, calling and asking questions. After the surgery, if you need your dressings changed, if you have a concern or a question, it's really nice to call somebody who's a couple miles away from you and who can say, well, why don't you come in this afternoon to see me? If you're having treatment by somebody who flies into town a couple times a month, that's just not available.
Yeah, we're showing the information right here. So if you suffer from any of these conditions we've talked about, carpal tunnel, if you think you have some tingling, you can give them a call at the office there at 717-0820. The website's at the bottom there. In a few words, I know we just have a few seconds, is there anything people can do to prevent this?
We used to think that losing weight, controlling your diabetes, taking medications would treat this, but we've found that those don't have a very high success rate. So recognizing the symptoms when they show up, getting prompt treatment, that's the
Making
most
the phone
important
call
part
right
of
away.
it.
Not waiting too long to act.
Don't wait 20 years, folks.
Don't do what you did.
Spoken
Don't
by
do it
somebody.
either.
That's right, Dr.
Doctor,
Clough.
thanks a lot.
Nice to meet you.
Thank you.
Thank
See ya.
you. Want to have